Hi, so today we're going to be talking about BMI or body mass index. So why do you care about that? Well, that's going to be very important on your weight loss journey to getting a good idea or a guideline about where you want to be or where you should be as it pertains to just good health in general. So BMI is not perfect. It has a lot of flaws, but on your weight loss journey, this is going to be a very, very good starting place. I always ask everyone when they're starting, how much do you want to weigh? What is your goal weight? And for a lot of people, they're not even really sure what that number means. They just have a vague idea of, I'd like to lose 20 pounds, I'd like to lose 50 pounds, whatever that number is for you. And that's okay. That's great. But for optimal health, for optimizing health, energy, reducing risk of mortality, chronic disease, all of those things, there is something called the general number that's been used, or a metric called body mass index, or BMI. So it's also an imperfect scale because it doesn't take into account a lot of factors like the differences between gender, body mass composition, lean skeletal muscle. So, but again, it is a really good guideline, kind of a rule of thumb, if you will, to get started. So why that is so important, because to know where you're going, you have to have a vision for yourself. And I talk about this all the time with our medical weight loss patients in our sessions. You have to have a vision, and then from there you have to have a strategy, kind of a game plan, and then the day-to-day tactical things that you're going to do to accomplish that vision. So this is really step one. Where do you want to go? What do you want your body to look like? How do you want to feel in your body? And like I said, just having a rough estimate of how much weight you want to lose is a really good starting point. But so this is, again, just a guideline. We're going to get into what is BMI, why it's important, why does it matter. Again, if you're outside of that healthy BMI range, above that kind of that 24 BMI, that is going to dramatically increase your risk of chronic disease, everything from cardiovascular disease, stroke, prediabetes, and diabetes, among many other things that have a very large correlation to that BMI number. Why is it imperfect again? Well, for example, if you have a large amount of lean muscle, you may be on the higher end of BMI, but a very low body fat percentage. That does not mean that you are unhealthy. So it doesn't apply to everybody. For the vast majority of people that are overweight or obese, in the morbidly obese category, it's going to be a really, really good starting place. So on our site, I have created this page on BMI, which has a calculator that you can go into here and put in your metrics and find out exactly where you are currently. So let's just say for a 6 foot tall person, or you put this in inches, and a weight of, at 6 feet tall, 250 pounds, that is going to give you a calculation of a 33.9 BMI. So if you scroll down a little bit lower, there's this chart. What you're going to be able to do on the left axis here, you're going to find 6 foot tall, and then you're going to go over to the right and then find the number that correlates to that weight. And in this example, we're off the charts here. So this specific chart, and I'm going to put in another one that reflects larger weight discrepancies, but we're outside of the healthy for six feet tall. We're going to be well above that, so we know we're in the obese category. So if you're 6 feet tall, what you want to do is find the lower range for a healthy BMI, which is about 19 here. So that's 140 pounds all the way up to 180. So this is very important for perspective as well. Especially for men, they say, well, I don't want to be 140 pounds, or I have a lot of muscle. Well, then maybe that's not a very good number for you. That's why we want to go back and look at other tools like body composition through a tool like an InBody, or even more accurate is something called a DEXA scanner. So now what you can do is go back, and if you're 6 foot tall, put in what you think your ideal goal weight is in your mind. So at 6 foot tall, at 180 pounds, that is going to put you at a BMI of 24.4. Go back again and find that on here, and we'll find that that is in our healthy BMI range. So that's great. And then we like to say, depending on how you wear that weight on your body, there is a lot of room for changes in here. So if you want to have more muscle, you're going to be able to be up here at a higher BMI if your body fat percentage is lower. So this is really conversations that we have once you are more at your goal weight, and we want to try to start making some adjustments to body composition. So I go in then again below this, and we talk about all of the consequences to a BMI outside of the healthy range. Underweight, this is one we don't see too much, but it goes into all of that as well. And then here are the risks: cardiovascular disease, diabetes, respiratory problems, joint problems, cancer, mental health issues. All of that has a strong correlation with unhealthy BMIs. For those that are looking for a more in-depth look at body composition, and I always do advocate that we start with an InBody scan in our medical weight loss program. And a reason for that is because we want to check body composition as well. It's more important, it's more accurate than just focusing on weight and a scale. Because in a weight loss process, especially when you lose a lot of weight quickly, there is some catabolism or loss of lean or skeletal muscle as well. We want to prevent that or minimize that as much as possible. What is that going? How are we going to do that? Well, a lot of times we are able to do that with offsetting that with hormone replacement therapy. Testosterone is a fantastic complement to semaglutide and rapid weight loss. So here we go. Well, let's just look at men for. So this is where you look at your InBody or your DEXA scanner, and so 2 to 5%. That's basically an extremely, you're going to have at least 2 to 5% of essential fat for your organs, your brain, among other things. So anywhere below that is not healthy. If you are an elite athlete, to be kind of in that 6 to 13% range. Just a normal fitness enthusiast, 14 to 17% is still quite good. Just a normal person, healthy range, 18 to 24%. So you'll want to take that InBody scan or that DEXA scan and compare it to these numbers. Then we approach body fat in the 25 to 29% range is overweight, and then increase above 30 is obese. So, and I go through this as well for women, all of the numbers. So you find yourself here. What we can do as well is we can start to look and say, I really like how my body feels when I'm like 14% body fat. I was like that in high school or in college, whatever that might be. And you say, that's a way that we can kind of adjust your weight to see where you feel best in your body. Talks about what do I mean when we say essential fat. Another really, really easy way to look at an ideal or a simple guide to health is your waist to your height ratio. So that should basically be less than 0.5. So if you have a 30-inch waist and you're 60 inches, 5 feet tall, that's fine. Better would be less than that. So 66 inches, 5'6", 32-inch waist, that's going to put you at about a 0.48. So that's a really, really quick, fast way to get a general rule of that. I mean, there's a lot more complicated things to this as well, because if you're unhealthy, if you're drinking a lot of soda, maybe a lot of fructose from high fructose corn syrup, you may be aesthetically leaner, but then you have visceral fat or organ fat, and that's also complicates things and makes it that you may not be very healthy. So I hope that was helpful. And then we talk about here getting an InBody scan, and we talk about that with all of our medical weight loss patients, that we have partners where you can go and stand in an InBody scanner. It's non-invasive. It literally takes about 1 to 2 minutes to get this done, and it's very, very easy. So if you have any questions about BMI, body fat, body composition, I would love to talk to you more about this in our medical weight loss program. If you have any questions whatsoever, please feel free to call or text us on our clinic line, or if you're a patient, you can also reach us in your patient portal or through our contact form on the website. So thank you very much, and I look forward to talking to you real soon.